I come from a clinical background. I worked in the emergency department of St. Luke's for many years, and then I worked on infectious diseases from the public health point of view, and now I'm working with the Chief Medical Officer within the Office of Policy Making. And this is one of my responsibilities, which is the management of the directive on cross-border healthcare. So my remit here is to describe this directive in as short as possible time. And as you can read, the title is Patients' Rights in Cross-Border Healthcare. What is the background of the directive? The background of the directive is that over a number of years, a decade or 2 decades or so, the European Court of Justice, ECJ, decided a number of cases that were brought in front of the court, and all these cases were on the subject of treatment acquired in other countries other than one's own country. And systematically, these judgments were in favor of patients. And the main principle here is that the Court of Justice of the European Union upheld the main principle of the Treaty of Foundation of the EU, which is the free movement of goods, services, and people. And healthcare is one of these services that is established as a right of the citizen, that where the citizen of the EU is assisted to choose wherever the individual needs to undertake his or her treatment. So basically, this directive is setting the right for EU citizens to treatment across borders. Thank you. As one of my previous speakers said, the legislation came into force and was transposed by our Parliament on 25th October 2013. And subsequent to that, there was another legal notice issued some 1 year later that defined some new definitions, but we will not go into this. Let me describe, before I go to the prioritization and the reimbursement phases of treatment abroad. The directive has created what is called the national contact points. These are individuals. There is one in every European country, including 3 non-EU countries, Norway, Iceland, and Liechtenstein. And these persons, these contact points, are responsible for the management of the directive in their own country. For Malta, I am the national contact point. We meet all contact points. We meet twice a year, either physically or virtually, and we cooperate with each other. We cooperate with the Commission. The Commission collects information on this directive every year, so we fill up that information and we send to the Commission. We have clear responsibilities dictated by the directive, and we are also responsible not only for the management of the directive, but also to make available to the general public, as we are doing today, information on the directive. Let's speak about prioritization. You've heard the term prioritization already, but on different aspects of treatment abroad. Now, with regards to the directive, the directive dictates that certain treatments abroad require prior approval or prior authorization. Okay? This is the Malta's prior authorization list. It is available on the website. It's already in the public domain. Basically, the first page copies the main article about prior authorization and describes what or which features require prior authorization. And on the other page, on the right side, there is the list of healthcare that requires prior authorization and healthcare that does not require prior authorization. For example, public vaccination programs do not require, are not the remit of the directive, as are treatments which are on trial or experimental phase. These are excluded from the directive, as they are excluded in other treatments. So one of the major important factors here is that if you want to go for treatment abroad through this directive, right, and you need hospital stay for 1 night or more, you require prior approval. You require prior authorization. You need to apply and you need approval before going for the treatment. If you go without approval, you will not receive reimbursement. It's as simple as that. Another important factor is the use of what is called highly specialized medical and cost-intensive medical infrastructure. This is a term that was created really by the European Court of Justice, and the directive, the Commission and the European Parliament copied what the European Court of Justice had decided over the years. And for example, if there is treatment or investigations that require CT scans or the use MRIs or radionuclear medicine, those treatments also require prior authorization and prior approval. How does one apply for prior authorization? My advice would be, first, speak to your consultant, speak to your specialist, speak to your doctor. Okay? You don't take rash decisions. You need to plan ahead, and you need to have clear ideas of where to go and what to do. So seek information on the healthcare and the healthcare facilities you need or you are seeking, okay? And inquire about the best options. If all information is available on the internet, you can do this from your own sitting room at home, okay? Over several sessions, you can easily learn the best options for you, okay? Still, it is advisable that you contact and discuss with your own specialist or doctor, and you also, it is best to discuss with the national contact point with our office, okay? That way, nobody can miss any prior approval or other important issues that will make reimbursement difficult. One needs to fill up an application form and send it to my office, all right? The website is easily accessible, and I will show you how to do it. And the information needs to arrive at my end, okay? What is most important if you are applying for a prior authorization or prior approval, you need a referral ticket from your own doctor. This is a must, all right? You cannot decide on your own to travel abroad for treatment. You can do so, but if that treatment requires prior approval and you would not have had prior approval, reimbursement will not be possible. And there are some treatments where the cost is really goes into the tens of thousands of euros. I assure you, we've seen 70,000, 80,000, 90,000, 40,000 easily. All right, and there are some of you who actually know what I'm saying. So why do we need a ticket of referral? Because the treatment abroad committee needs to have the necessary information in order to decide. Not only that, but we need to make sure that that treatment is actually necessary. All right? No individual needing prior approval before going abroad will certainly be reimbursed unless one has that approval beforehand. Okay? And we must ensure that that treatment is really necessary. Okay? So the referral ticket needs to explain the condition that the patient has and why the treatment abroad is being requested. This is the prior authorization form. It is available on the website, or else you can send us an email and we'll send you the prior authorization form. You fill it up by hand, scan it, and send it to us, or send it to us as a hard copy. This is the website. This is part of the website. There is more information beneath this page. The website will be replaced by a new website later on this year, but so far the information is more or less correct. What happens when I receive a prior authorization form, which is fully filled, signed, okay, and also together with a referral ticket? I will raise those documents to the Treatment Abroad Committee. We use the internet, the emails nowadays. We don't meet physically, as Charlene has already said. And the committee will evaluate each case on a case-by-case basis. It will take the specific condition, obviously, into consideration. And if there is an urgency to the treatment, okay, other routes may be proposed instead of cross-border, or sometimes vice versa. We recently have had one case which the initial proposal was through cross-border healthcare, and eventually you send the patient to the United Kingdom. And this really has never happened, but if there is a safety and quality issue of the healthcare or health center or hospital where the patient is proposing to go, that is taken into consideration. Okay? Once the decision is taken, and this is taken within a couple of days, my responsibility is to send an official approval letter to the individual through internet, through email, okay? And the individual can travel freely and then will be entitled for reimbursement. There are some healthcare situations where prior authorization, prior approval is not necessary. If you go for a simple consultation in Munich, Frankfurt, Rome, okay, you do not need prior approval, okay? You collect the documents that we require and then send us the documents after you return to Malta, right? If for investigations is the same, however, if those investigations include CT scanning, MRIs, radionuclide medicine, or genetic tests, those require prior approval. If you're going for day surgeries, day procedures, unless the use of MRIs or CT scans or radionuclide medicine is going to be used, okay, they do not require prior approval. It is only rare that prior authorization has been refused, very rare. We've had 2 cases where the individual asked for experimental treatment. For the rest, okay, it's true that the directive raises this prospect of quality and safety of healthcare in a particular center or not, okay? We keep that in mind. However, most of the healthcare that we deal with are in university hospitals such as Frankfurt, Rome, Munich, etc. So university hospitals are university hospitals. We also, if necessary, go into the internet and check whether the specialist does exist, okay? If the center actually provides that treatment you're asking, And so I do this work, all right? And this is because other countries, I think Ireland, have had at least one case of fraud where an individual had brought up a demand for reimbursement from a center in Germany that does not exist. Okay? A short note on Brexit. After Brexit, from December 2020 onwards, all right, the directive does not apply to the United Kingdom. So it's clear that people who want to go through to the United Kingdom through the directive will not be approved. And if you go for consultations in the United Kingdom, no reimbursement is possible. Let's describe in short some principles on reimbursement. Healthcare must be part of the Maltese healthcare package or National Health Service. And I'm quoting here, the amount that is reimbursed to the individual is the amount that is equivalent on the Maltese healthcare package. Okay, so the way we estimate is if you go for an operation, okay, we see how much that operation costs on the Maltese National Health Service. It is usually lower than some of the most expensive countries, such as Germany, all right? Whereas in Greece or Spain, it might actually be lower than ours. It depends, okay? But I've seen some cases in Germany where the cost, for example, of radiotherapy or complex surgery for cancer has costed 70,000, 80,000 euros. All right, and the individual might receive around 20 or 30,000 depending on the case. So, and estimation is really a bit complex. What documents do we require for reimbursement? Certainly, we need medical reports, we need invoices, preferably itemized, and a fiscal receipt or a bank statement. We also ask for identification documents. If you're a European citizen, I don't know, not Maltese, but European citizen, we need a copy of the resident card. If you're Maltese, we ask for a copy of the identity card. Why do we need this documentation? Obviously, we need this documentation in order to work the reimbursement values. But also, we must ensure that the healthcare episode, that treatment has taken place, that payment has actually taken place. All right? Each patient's file is available to the National Audit Office. All right? So we try to deal with reimbursement in a completely transparent manner with the patient. Okay? So we are completely open with the patient. So the client, the patient will know where the estimates are. We give the patient every detail, all right, in a form of table. Some of the individuals, most of the individuals actually will have no complaints. A few individuals complain because they think that the estimate is very low. But each case is dealt with on its own. So prioritization refusals, they are rare, and we've had 2 with experimental treatment. If you think that, or some client thinks that he or she has been mistreated by our office, right? The right of appeal and redress is through the Ombudsman's office, healthcare office. Okay? Reimbursement or refusals, also very rare, only where prioritization has not been sought before treatment, and sometimes in case of IVF treatments, some of the treatments that clients have undertaken in other countries, mostly Spain or Greece, have gone beyond what is allowed by Maltese legislature. So, almost a summary, but these are the requisites for prior cross-border healthcare and reimbursement. This is planned treatment. This is not emergency treatment. Emergency treatment does not reach out to cross-border healthcare. Okay, we've had, I remember one individual who had an emergency. He went to a private hospital in Germany. He had a bill of, I think, if I remember correctly, around 45,000. So he went to a private center. It was emergency treatment. He couldn't receive reimbursement because he was not treated in a public hospital, so he ended up with a bill from which he did not receive anything. Okay, so, and this is important. The second item is important, all right? This is, the directive is the only law, the only directive, the only regulation of the EU that allows treatment in a private center, not only public, but in a private center, and allows reimbursement. All right? The other treatments mentioned before by my previous speakers, all must be given in a public hospital or clinic or center. As we said, treatment must be necessary. Now, this directive applies to Maltese people. It also applies to third country nationals, including EU citizens and other citizens who are paying national insurance in Malta. If you're an Italian living here and you're seeking this directive and you're not paying, but simply you're not paying a national insurance, but simply you're living here for some reason or other, all right, you will not be allowed to go through this directive, or at least you will not be given reimbursement. So we seek also entitlement, as described earlier on by Michelle. Patients pay upfront. That is, they go for treatment and they pay there and then from their own pocket. Once you finish the treatment, you come back to Malta, you give us all the documentation that I referred to earlier on, and then we work that reimbursement after that. And healthcare, as we said, must be among the benefits of entitlement in Malta in this case. So, to conclude, I put in this slide not to make things difficult, but to show you that the directive, this cross-border directive for patients' rights, is more complex and more dedicated to patients' rights in various ways. Okay, Charlene mentioned European reference networks, which emanate from this directive. There is the rare diseases cooperation between the member states. There is the e-health, electronic health record sharing for emergency cases, and Malta was one of the principal countries, together with Portugal, who provided this service within the EU. Recognition of prescriptions issued in another member state. So you can travel to Germany, you can have a prescription, go to a pharmacy in Germany, and that pharmacy should give you the medicine you need, provided that that prescription has the full details as dictated by EU law. There is a specific law or sort of legal notice on this aspect. And there is cooperation on health technology assessment. So basically, in conclusion, I think the take-home messages are there are various channels to access health abroad, as we mentioned this evening. Always plan ahead. This is planned treatment, okay? Seek help from treatment abroad, entitlement units, or our offices, okay? And seek your doctor's advice. I think this is all. Thank you.